There's no question that healthcare should be provided and be a given right for every human being on this planet. When we began this program 5 years ago, everyone, including me, was unsure as to whether or not we'd be successful here. 5 years later, having seen so many pieces of it come together is a source of great pride and joy for both me and for many of the others who are so important in making it successful. We have a program built to provide very high-level, high-quality surgery, and it's taking place in a small village on the banks of the Nile River in eastern Uganda.
Kyabirwa is a story of giving hope to the most vulnerable people in our communities here in eastern Uganda.
This whole program at the Kyabirwa Surgical Center began with an understanding that as many as 5 billion people on the planet do not have access to even the simplest of surgical therapies.
Sometimes for even small surgical needs, patients needed to struggle and go to Kampala, which is 3 hours away.
If they had gallbladder disease, they lived with the pain. If they had an acute appendicitis and it went untreated, it could take their life.
The people living in Kyabirwa right now can testify to the fact that they no longer have to sell off their property to get basic surgical care.
Now they can receive these treatments not only with the most advanced forms of surgical care, but actually get them in their own community, in their own neighborhood.
When Dr. Mann approached us to build this surgical center, the initial reaction was, wow. I mean, this is a daunting task.
Every great thing starts out with a step. And who knew that it was going to be as successful and run as well as it had been run in about 5 years. And I think when the match is lit, it takes off.
Designing in a place which is very close to equator, how do we ventilate each of these spaces? And since the center was intended to be fully self-sustaining and environmentally sensible, we had to come up with ways on how do we save water, how do we collect water, how do we store it, without compromising the kind of infrastructure you need for high-quality healthcare.
We manage this by having large rainwater collection and filtration systems, massive solar array with accompanying battery bank.
This is a great idea. This is something the world really needs. You very rarely run into that kind of an idea, and just immediately we wanted to do anything we could do to help.
The story of Kyabirwa is really about collaboration.
One of the basic requirements for Dr. Mann's vision for the center was direct communication and collaboration, real time with Mount Sinai, the doctors here, and worldwide too. And in order to make that happen, you need to have good data stream, and we brought in fiber optics.
We are bringing modern endoscopy techniques to areas that have never seen endoscopy before. We can see 100% what they're doing. It's just as if I'm beside him in the endoscopy suite at Mount Sinai.
I would say lean on the side of the gallbladder when you start dissecting. It's like 1.5 centimeters, and that's it.
For laparoscopy, I've been teaching Dr. Joseph on how to do a laparoscopic inguinal hernia repair, which is practiced very frequently in the US, but is almost never done in Uganda.
And the area you're tapping right there is where we would opt to view in anyways.
They offer tips and tricks in making the procedure much better. But she has gone beyond. They are able to actually teach or guide me through new things that I need to learn.
I am really a partner of the team in Uganda.
Right, thank you so much.
Yeah, no problem.
Have a good day.
That fiber optic network is the key to having real-time communication and collaboration between the center and New York.
The role that I play in the Kyabirwa Surgical Center is the radiologist. So I am their go-to when they have questions about any of those scans, about what the diagnosis could be.
The void I'm filling over there is the presence of a pathologist. I do the interpretation and the analysis of the tissue, and I create a report with my interpretation with the results to give the patient the proper diagnosis, which is going to help the clinician for the next stage.
Digital technologies, video communication in the operating room, the ability to do that in a dynamic fashion has been a game changer.
The facility is evolving exactly as originally envisioned by Dr. Marin. It is a model for how healthcare can be transformational.
Many people believe that building surgical resources is too expensive or too complicated to accomplish in off-the-grid, remote places.
It was a $800,000 project to create a hospital in a community that didn't have any medical services that could perform maybe 80% of what we perform here in this hospital in New York City.
We came up with the idea, we followed through with it, and we built a facility that's world-class.
If we look at the cost, which has previously been thought to be too great and too complicated to achieve, one of the things that the Kyabirwa Surgical Center has shown is that it doesn't have to be seen that way.
We are excited about the opportunity to expand this model further and to continue to serve more communities.
Kyabirwa can be a model of how we deliver high-quality healthcare to underserved populations in the most remote places.
I feel by joining forces we can amplify this model and use it to bridge the gap that exists in affordable access to surgical care in rural communities.
We're interested in what's beyond this community in Uganda, and any other ideas that Dr. Marin has will support.
We're changing people's lives for the better. What's that worth? People that have had the surgery in a better place, but their families are in a better place. People that couldn't walk can now walk. People that couldn't work can now work. You know, that's worth a lot to us. And we hope it's worth a lot to other people too.
We can do this. We can impact our own people. We can work together to change the narrative of hopelessness in rural communities. We can change that and work together to give people a better life.